Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Whether it's recovering from an illness, injury, or working to improve your mobility, physical therapy plays an important role in your health care, with the common goal of improving quality of life through increasing overall strength, flexibility, and function. Physical therapy could be your ticket to improve mobility and health. Today we're discussing what physical therapy is and what it can do for you. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm Janet Whitmoyer, your host. Stay tuned. Welcome to Healthy Living for Life. Joining us now is Tori Widowick from Peak Physical Therapy and Sports Rehab. Welcome, Tori, and thanks for being here.
Thank you for having me.
Sure. So let's start out first by having you tell us what a physical therapist, or sometimes you've heard of them called as a PT, does to help their patients.
So physical therapists, their main goal is to return to prior level of function for their patients. So we're working with them one-on-one to see what their goals are, if they're coming in with pain or restriction, and trying to getting them back to doing what they love to do.
Okay, so what are the primary goals for physical therapy when they're working with the patients? You just mentioned pain.
Yeah, definitely. Pain is a huge one.
Okay.
And so usually someone's coming in because they can't do something that they love.
Okay.
And so getting to know the person one-on-one and understanding what they want to do, and then tailoring a program or a treatment so that they can get back to doing what they want to do. So if it's sitting on a couch watching TV without low back pain, perfect. Then we'll get you back to doing something like that, to hiking a mountain as well.
So can you tell us some of the common conditions? You mentioned a couple that physical therapists do, or some of the conditions that they treat.
Yeah, so physical therapy is very diverse. We're treating people from pediatrics to elderly. And so we're doing neurological disorders such as stroke, Parkinson's, MS. We also have a lot of orthopedic dysfunctions that we treat, such as rotator cuff, low back pain, acute and chronic. We can do wound care as well. We can do pelvic floor dysfunctions, incontinence, bowel and bladder. We also do a lot of balance and exercise and strengthening for the general population as well. Concussions and headaches are another big thing that we do. And then vestibular rehab, which is more vertigo, dizziness, lightheadedness with those patients as well.
Wow, that's quite a variety of modalities. So can you tell us about some of the more common modalities and how they're used in physical therapy?
Yeah, so there's quite a few modalities we can use in our toolbox. We can do a lot of manual therapy techniques. That's what we do predominantly at our facility. A lot of hands-on, soft tissue. You can do mobilization of the joints, some manipulation. You can use, a TENS unit, ultrasound. You can do exercise, stretching. Dry needling is another big thing as well.
Okay.
With that.
So I can imagine that this is quite a long experience or educational journey that you take to become a physical therapist. Can you tell us a little bit about what training you received to become a physical therapist?
Yeah, definitely. So there's two different ways you can go in your schooling with physical therapy. You can do a 3+3 program, or you can do a 4-year degree to start out with. The 3+3 is you're going in as a junior of your undergrad, and you take all your prerequisites, you do the interview process, job shadowing hours, and then you get into PT school. So that's a fast track. Okay. Or you can do a 4-year degree and you take your prerequisites and your job shadowing interview, and then you go into PT school, and that's a 3-year program. It's continuous as well. And then you do 4 clinical rotations in your PT schooling that are in different areas of PT, such as acute care, ICU, inpatient, or outpatient, and you kind of get to see what area you want to go to. Then you graduate, and you'd have to take the national board exam, pass that. And then after you do that, you can then go into maybe a residency or a fellowship, which is just another year-long program with a mentor to kind of focus or hone in on skills that you want to do, such as manual therapy, sports, or pediatrics with that as well.
Wow, that is very extensive.
Yeah.
So wonderful. Okay, so when somebody gets referred to a physical therapist, can you walk us through what the process is that they'll go through to begin receiving physical therapy?
Yeah, so every clinic has a different way of kind of setting up their initial evaluation, but every PT is going to probably approach it the same way. So you're going to walk in the first day and you're going to tell us your story, and that's the most important thing because you're going to tell me what you can't do. And so from that, I can then think of what am I going to test to see what you're restricted in, what you're limited in, so that you can reach your goals in the future. And so we'll do strength testing, range of motion, maybe some reflexes, check your mobility. Can you get out of a chair? Can you put your shoes on? And we just, from that, we can see where we need to work with our treatment. So we talk to you about how long your duration of treatment will be, and then the outcomes and your goals as well.
Okay. So could I come in without being referred from my physician, or is this something that needs to be referred before we can come see a physical therapist?
So the state of Montana, and there's pretty much all 50 states, there's some provisions to it, but we have direct access, which means that you can walk in from the street and ask for PT care.
Okay.
Saying that there are some insurances such as Medicare and Medicaid that you do need a referral from a doctor before you see a PT.
Okay. So pretty much check maybe with your insurance to see first. Okay.
Definitely.
All right. So for a person, a lot of times if they go get PT, they're having some pain. If people are very concerned about coming and getting physical therapy that might cause more pain, what would you have to say to them to reassure or alleviate that concern?
Yeah, so I think that's a lot of people get nervous about PT because they think we're going to put you in pain, but our goal is to figure out what is causing your pain and then decrease that. So a good thing is to talk to them about what is the difference between pain versus muscle soreness, and asking them, is it sharp? Is it never going away? Let's talk about that, because there's ways that we can help you and educate you for what you're doing at home. Maybe you're doing something and sitting too long and that's causing your pain. Is there something that we can change with that? So telling them not to be afraid that we may cause some pain to elicit, but we can help you with ways to get rid of that pain as well.
Okay. In about the last 30 seconds, I was wondering is when you do exercises with the people, you're usually doing them in your clinic. Can they do the exercises in the facility or at home as well, or do they always have to be done in the facility?
No, they can do both. I have patients that do workout routines at the gym and at home as well. It's important to do it at home because that is where you're at most of the time. You're not at PT 24/7.
Okay, so it's kind of like a lifelong type of training.
Yes, definitely.
Okay, perfect. All right, well, thanks for that information. Up next, we'll be talking to Tori about how physical therapy can help seniors stay active and mobile. We'll pause here for a short break and be right back.